Ladies and gentlemen, I give you a warm welcome once again on SR TV Lab. As you can see here, today we are going to see how to do ECG recording, the electrode placement, and how to print the electrocardiogram or the ECG paper with the function of the heart on it. That is what we are going to see today, so enjoy. First of all, this is the electrocardiograph. It is the machine used in ECG recording or electrocardiography. So before you start recording, you unplug it. When it is charging during ECG recording, it might lead to some artifacts or interference. Here we have the electrodes. Let me show them to you clearly. Good. These electrodes are the one that placed on the patient's skin. Here is the red electrodes. Here on the cable of the electrodes, it's written where to place it. Here is another yellow electrode. Good. This is a green electrode. Even on the cable, it's written here is a black electrode. It is a neutral electrode. You will see where to place it. So here we have the ECG cable, and here we have the transducer, the one that takes signal from the electrode into the electrocardiograph. Good. Start the procedures. First of all, you have to know the patient's position. A position should be the anatomical position, the spine lying or lying on your back, the palm facing upward. And the top cloths have to be removed in order to access the chest, because we'll place some electrodes on the chest. Good. The next step will be just to put the electrodes on places. Good. A patient has to calm down, not talk during ECG recording. Good. Here we start with this red electrode. Here, this metallic part, let me show you it clearly. This metal part, it is the one which is electrode. The other one which is red, it is just a clamp, the one that is help us to better place the electrodes on place. This is for the right arm, the right arm electrode. Red electrodes is placed on the right arm, so it's very easy to remember. Red electrodes on the right arm, but we place it on the wrist joint. Good. It is called arm electrode, but we put it on the wrist joint. Good. This is for people who have the limbs. What if someone is amputated? We are going to see where to place them. Good. This yellow electrode is placed on the left arm. So actually, before we put other electrode, when you don't have the rims, the electrode are placed at the shoulder. The one on the upper limb, the one on the lower limb are placed just at anterior superior iliac spine, just medial to it. That is where we place the electrodes of the lower limb. Now, this green electrode is for the left foot, but we are not going to put it on the foot. We will place it on the ankle joint of the left lower limb. You are going to see how to place it. This is for the left lower limb. Good. This is the right lower limb. No, this is the left lower limb. Let us place the electrode just there on the just here above the ankle joint, immediately. This is where we press the left foot electrode. We say left foot electrode, but it's put at the ankle joint. Good. Now we have another black electrode. This one is a neutral electrode. We are going to put it on the right lower rim. This is how we press the electrodes of the rims. Good. Let me show you clearly. Here you see green on the left foot, black on the right foot. Good. Red on the right arm, but at the right wrist joint. That is why we press the red electrode. Here we come to the to the left. This is yellow electrode. We go back to the left foot, green electrode, right foot, black or neutral electrode. We are done with the limb electrodes. Now let's go to the chest. Good. On the chest, we are going to use 6 electrodes. On each cable is written the number of the electrode. We start with C1 electrode or chest 1 electrode. Actually, the C1 electrode is placed on the 4th intercostal space, right edge of the sternum. So you count from the clavicle downward, you will be feeling the spaces. Between ribs, it's very soft. You will count up to 4, the 4th intercostal space. It is at the same level with the nipple. That is where we are going to place C1 electrode. Just right edge of the sternum at 4th intercostal space. Good. That is where we are going to put C1 electrode. Right edge of the sternum or right border of the sternum on 4th intercostal space. C2 is placed at the same level with C1, but at the left edge or left border of the sternum. Good. Then we are going to skip C3. First of all, we're going to place C4. Why C4? It's known where to place C4. C4 is placed at 5th intercostal space. Just it is 1 intercostal space below the 4th. Good. So we have to move down a bit from 4th intercostal space to 5th. 5th. But at which level? At mid-clavicular line. I'm going to show you. You just see where the clavicle deviates from the clavicle, just mid-clavicular line. Then you draw like a marginal line that just where it is intersect with 5th intercostal space. That is where we press C4 electrode. Good. Then C3, it will be at the mid distance between C4 and C2. Remember C4 at 5th intercostal space where it meets with the mid-clavicular line. Good, we are done with C3 and C4. Now let's go to C5. C5 is placed at the anterior axillary line. When you see the axilla, it has a prominence anteriorly, and then within the armpit, it is the mid-axillary line. Then posteriorly, there is another called posterior axillary line. Here, C5 it was anterior axillary line. Then C6 it's mid-axillary line, just within the axilla, but at the same level with C5 and C4, the 5th intercostal space. That is where you place all chest electrodes. Now we are done with the electrode placement. Let us switch on the electrocardiograph. Good. You see, the screen is on. Here on this electrocardiograph, you press F1 button in order to see the reads on the screen. Good. And another thing, when you remove one electrode on its position, you are going to see what is going to happen. Look at the screen. Look, things have become chaos. Everything has become bad. But when you put it back on its position, you are going to see what happens. Good. Everything become normal again. So the next step will be to print out the electrocardiogram. Electrocardiogram, it is this paper with heart tracing on it. It is called electrocardiogram. The machine is electrocardiograph. And this whole process of recording the ECG, it is called electrocardiography. The process is called electrocardiography. The machine is electrocardiograph. The paper is electrocardiogram. So on the screen you can see these are the reads. Good. Then the next step will be to switch off the machine. You get me? Remember, there are so many types of electrocardiograph. This is the one that we have here. Good. The next step will be just to remove the electrode from our patient. And we will see in the future how to interpret the ECG step by step. It's a very long course. It requires speciality. So, but we'll see just some of the basics of ECG interpretation. So we are removing the electrodes. Good. Good. Our patient has behaved well. No talking, no moving during ECG recording. Good. This is how it is done, guys. Good. The last step is to screen your patients and thank him for being a good patient, for good cooperation. Good. Our patients has done well. Thank you. Good. So, guys, thank you for watching the video. I hope it's very helpful. So please, don't keep this information just with yourself. Share this information to your colleagues. And see you in another video next time. May God bless you abundantly.